It's been 6 years since David Riggs retired.
I got hired in 1985 and I worked for 33 years.
He was a Garland firefighter and former president of the Garland Firefighters Association. In his time, David has seen friends and coworkers fight the health hazards of this job.
We rode the ambulance together for years.
He remembers Curtis Bruce was diagnosed with multiple myeloma.
Curtis passed away shortly after he retired.
Curtis's occupational cancer diagnosis came shortly after he retired, so David says none of the medical bills were covered.
Workman's compensation ends the minute you stop being an active duty firefighter.
Currently, Texas firefighters on the job at least 5 years have a list of cancers that can be covered under workman's comp. The CDC recognizes firefighters are at a higher risk of cancer, heart attacks, and stroke, and sometimes they aren't diagnosed until after retirement.
But those exposures are still there.
It's why David is hoping for movement at the state capitol. House Bill 4144 would provide benefits to retired firefighters or officers who are diagnosed with an occupational disease within 3 years of retirement.
The bill has a cap of $100,000.
Cities would be responsible if a retired first responder is diagnosed with cancer, heart attack, or stroke within that time frame on this exception.
If a city has that kind of benefit in place where they're providing the health care for their retirees up until Medicare, then they would not have to provide this supplemental policy.
John Riddle is president of the Texas State Association of Firefighters. They are behind this bill.
Do you feel like 3 years is enough, or would you like that number to increase at some point?
I would like for it to be longer.
If this bill is passed, it would take effect September 1st of this year.
Well, this legislation is taking care of those that take care of you.
In Garland, I'm Tiffany Liu.